So Children's Mental Health is an organization. We're part of Health and Welfare in the state of Idaho. And I'm Kyle Hansen. I'm the supervisor of our program. We've got 6 clinicians on my team, and we cover 6 counties. What we do is, in the past, we've done a lot of assessments. That's kind of been our role in qualifying people for services. A couple of years ago, we were able to add a Medicaid waiver for serious emotional disturbance. And so now our role has shifted. We don't do as much of the assessments, and we're doing a lot more crisis work and also wraparound. So those are our kind of big focuses, but we still do a lot of multidisciplinary meetings. One of the things that I'm really proud of is just our team's willingness to be flexible and meet people where they're at. I know I've had clinicians going out and going to clients' homes and taking them out for a walk. We have a few clients, just teams that are really struggling and isolated. And so getting them out and just trying to help them interact and still be a part of some sort of a community has been really something that I'm proud of that my clinicians have been doing. And so as we've shifted to this crisis work, we've also got flex funds, which I think is really exciting. I hope quite a few states have those, but it's something that's new to us. And so typically that looks like buying things like lock boxes or security camera, door alarms, those types of things. But we focused more at this time, buying art supplies and puzzles and games and just things to try and help people connect and have a good time, because it's stressful being at home with kids all day. I have 6, 4, and almost 2 at home, and it's hard for us, and I can only imagine what it's like for kids and families that have a serious emotional disturbance or have other stress to begin with. So I'm really proud of that flex funds we've been able to do in the crisis response there. And then for our wraparound families that we know better, we've tried to individualize those crisis stabilization packages. We know their strengths and needs really well. We use the CANs, but we love being able to come up with creative solutions. And so one of them that I'm most proud of is we have a youth. He's in our first episode psychosis program too, so pretty high needs. He loves the electric guitar, but that doesn't work for his family at all hours of the day. So we're able to get him some headphones, and now he can jam out whenever he wants without adding to the stress that his parents are already feeling. So that's one that I think is really cool. And I've definitely been encouraging all the clinicians to be creative, use their kids' strengths, and see what we can come up with. And then I think, what we really try and do best right now, as we've learned wraparound, is do those principles of family-driven and youth-guided. Whatever it is that the youth and family need, however we can connect with them, we'll do our best. And so we've been calling just to check in and see how people are doing. And I think that's been one of my favorite things, is just people appreciate a phone call, especially when it's not connected to, I'm reminding you about your meeting, or I needed to ask you about this, or I needed your signature for something. Just a genuine phone call to say, hey, how are you? We've been wondering how things are going. And so that's one of the things I hope that we'll continue the most to do, is sometimes we get stuck in our roles and we just stick to what we have to do. And being creative and just connecting with people on a different level, I think really has been a good thing. And I hope we can continue that in the future. I'm also really excited about the telehealth. Some of the things that have been happening, it's actually worked great. Sometimes it's a lot more convenient for families, even the ones that are here and could come. So for the families that live 2 hours, that's how big our region is. It's about 2 hours to get to some of those outlying communities. A lot easier just to join on the internet or a phone call. And I think, just the biggest hope is that we'll continue to connect with people on a different level than we did before, and learn some of the creative things that have worked, different strategies than we've used in the past. And I know that's something probably all around the country. We're all trying to be creative and meet needs. It looks a little different everywhere.